This is a special report from News 3 WSIL.
Hello again, I'm Mark Kiesling. Tonight we continue our new segment called COVID Conversations. We'll look at COVID-19's impacts here in our region and what it means for you. For that, I turn it over to my co-anchor, Julie Williams.
Yeah, thank you, Mark. We're joined tonight by Dr. Jeff Ripperda with Shawnee Healthcare. Dr. Ripperda, I want to thank you so much for joining us and for being here. Now, I want to start out here today. You had a pretty impassioned and alarming Facebook post. There's a pretty significant spike in COVID-19 infections. Walk me through what you're seeing.
Yeah, so let me preface this by, I guess, saying who I am and what I do. So I do family practice. I run my own practice in Murfreesboro, work for Shawnee Healthcare there, and I'm the medical director of our same-day clinic in Carbondale, which is Shawnee Healthcare's primary COVID testing site. And I serve on a bunch of committees through Southern Illinois Healthcare. So that's kind of my world, a bunch of meetings there. But the organizations are sending out the alarm that COVID cases have spiked over the past several days to the degree that it's affecting our ability to provide effective health care in the region. We have 58 people hospitalized just with COVID. I just checked that number before I came over. That's up from 51 this morning. So it's 7 people just today. And that might not sound like a lot. If anybody's not familiar with the healthcare system of our region, we have, depending on how you count it, 200, 250, maybe 300 beds. And COVID taking up 50 of those beds is really a big chunk of what we have available. And it's not just that those people are sick, it's that they're very sick. They require more nursing, they have to have private rooms. So they take nurses away from other parts of the hospital. So instead of a nurse who typically works doing colonoscopies or who typically works in the emergency room, she might be taken away to work in the COVID unit, and that's just that, it's one less person to work elsewhere. And our ERs are frankly overwhelmed. We're seeing a major issue with people coming into the ER for COVID testing. One of the higher ups at SIH specifically asked that I request that people not go to the ER just for a COVID test. ERs are struggling. When I talked to somebody this morning, wait times were in the neighborhood of 8 to 9 hours at most of the local ERs. They've come down some to just 3 to 4 hours last time I checked again, but still very significant. So I just encourage anybody that if you're anything less than super sick, or if you just want a COVID test, please contact your primary health care provider, one of the SIH outpatient clinics or the Shawnee Healthcare walk-in clinic in Carbondale to get a COVID test. We really need to try to take the burden off the hospitals to any degree that's possible.
And with the ERs tonight, also in your Facebook post, you said for the critically ill patients, are you able to take them in, or where can you send them right now?
So we have a shortage of, when I say a bed, I think a lot of people maybe don't understand what that means. There's plenty of physical beds at the hospital. When somebody who works in healthcare says a bed, what we mean is a designated space where we can put a patient. That means that patient has a devoted nurse, devoted equipment to help take care of them, devoted space through the pharmacy, through the computer system. So it's more of this sort of abstract idea of having a bed. Every hospital within 2 hours in every direction that you could drive from here right now has ICU beds that are full. So if somebody is critically ill in Southern Illinois right now, if you show up to the hospital and you're critically ill, we can't guarantee that there's a place for you. And that's kind of a scary idea. And I'm a little shocked to even hear myself say that in America in the year 2021. Yeah. But not only if you show up super sick, we can't promise that we have a place for you that's appropriate. Now, we will do our best. We will find you some sort of hospital bed with the best nursing care that we can offer, but it's just not the same as when we have the proper setup going on and enough space to do that. But then again, the bigger problem is usually when that happens and there's not space, we call other hospitals. We call hospitals in the Metro East, in St. Louis, in Cape Girardeau, in Paducah, in Evansville, Indiana, and say, we don't have the proper type of bed for this patient. Do you guys have something available? And right now the answer from all those places is no, they don't.
Scary. And may I ask too, however much you're able to disclose those cases that you see coming in, are they vaccinated? Are they unvaccinated?
So SIH, Southern Illinois Healthcare, does keep track of that. Of people who are being hospitalized, 85% of those being hospitalized are unvaccinated. Of those who have died since the Delta variant showed up in the region, nobody who has been vaccinated has died since the Delta variant showed up. Southern Illinois Healthcare has had 2 patients who were fully vaccinated died. Both were elderly and immunocompromised, which means the vaccine probably didn't work in them as it should have. But the vast majority of people who are dying of COVID are unvaccinated, both locally and nationally.
And Dr. Ripperda, if I may, being that you work with families, we've been reporting on a spike in pediatric COVID hospitalizations too. Okay. What goes through your mind when you see those numbers coming out every day?
So luckily, up until a couple of weeks ago, I personally haven't had to hospitalize any of my own pediatric patients with COVID. I've had several dozen pediatric patients with COVID through the pandemic, but had a young person who actually got very dehydrated, didn't have typical respiratory symptoms of COVID. She puked her guts up and couldn't keep any fluids down and wound up having to be admitted. The hospitals are seeing spikes of pediatric patients. Generally, they do okay, right? So we're not seeing pediatric patients get critically ill. Generally, with a little supportive care, they do all right. But noticeably, over the past few weeks, more kids are getting COVID. And the biggest problem is those kids give the COVID to the people around them, more so than that it's an imminent threat to their health.
And I want to pull off of that too. We actually have a viewer question. Can children spread COVID-19 even if they are asymptomatic?
Yeah, anybody can spread COVID-19 even if you're asymptomatic. One of the biggest problems with COVID is that you're contagious for a couple of days before you start to show symptoms. So you almost couldn't design a disease to spread through an entire community better, because you can be walking around feeling fine and spewing virus everywhere. So about the most contagious a lot of people are is a day or two before they'll start to show symptoms. And kids certainly fit in that group as well. There's some research that's come out that says maybe even the younger a kid is, the more contagious they are. Anybody who spent much time with kids knows that they're not terribly careful about not spreading germs. And if you think about it, if you have a sick 1-year-old at your house, what do you do with a 1-year-old? You cuddle them, you hold them on your lap, you have to feed them, so you're in a whole lot of close contact. Meanwhile, your teenager's hiding in the bedroom, not wanting to interact with you a whole lot, so they're just a little less likely to spread the virus around the house.
And pulling off on that too, you know, a lot of schools are already back in session. A lot of them in our area do have the mask mandates. But if you're a parent and your student comes home, a classmate has tested positive, what steps should you take for your children, and should you get tested? Yeah,
so every school should have some sort of protocol or policy in place, and they've all worked with their local health departments to decide what they're going to do in those situations. Anybody who's exposed to COVID, kid, adult, typically recommend you get tested about 3 to 5 days after you've been exposed. So generally we're going to tell you quarantine, stay away from people, and get tested a couple of days later. If you get tested the day after you're exposed, the problem is the test might not have time to turn positive yet. A lot of people will get nervous after they know they've been in close contact with somebody from COVID and they want to go get tested immediately. And I understand that reaction, but you're actually better off waiting just a couple of days.
Waiting a little bit. And you know, with that, a lot of times we hear, well, you know, children, teenagers, they're younger, they're stronger, they can fight off a virus more easily. So for the kids who are eligible for the vaccine, how important is it that they still get the shot?
So, I mean, I put my money where my mouth is here. I've got 4 kids, 18, 13, 13, 12. They all got the vaccine within 2 days of being eligible to get it under the federal guidelines. One, I think it's doing a bad job as a parent to let your kid get sick when it's avoidable, and especially when they have the chance to spread that around to other people. And if I knew that one of my own kids had gotten sick with COVID, recovered, but gave it to a neighbor, a teacher, a friend, and that person got very sick, had to be in the hospital or died, that would be a very hard thing for me to live with.
Yeah, good point. And, you know, from the healthcare perspective, are there different requirements to have a vaccine approved for, you know, kids or even teenagers?
So the FDA generally requires a higher level of study and of evidence to approve any sort of medication or vaccine for kids than they do for adults. And that's true of the COVID vaccines too, which is why it's taken a little bit longer than it has for adults. For better or worse, the FDA basically treats everybody 18 and up the same. That's not true, of course, but that's basically how drugs get approved in this country. And below that age is just looked at differently. So drug companies have to show very meticulously that a drug is safe, but not just safe because they won't treat a 16-year-old like they treat a 2-month-old. The onus is really on the drug company or the company making the drug, the vaccine, to prove that it is safe in all age groups before it would be approved for those age groups.
And kind of switching gears here, we've been talking about vaccine hesitancy, and we have heard, some questions, comments, concerns about women who might want to be pregnant or might want to get pregnant. Are there any side effects associated with getting the COVID vaccine that could impact a woman's ability to conceive?
So let me tell you what we know about women who get COVID while they're pregnant first as a comparator. Pregnant women are maybe a little more likely to get COVID. The body's immune system has to calm down a little bit during pregnancy so that it doesn't go haywire and accidentally attack the baby. So pregnant women are a little bit predisposed to getting all sorts of diseases, and COVID is one of those. And pregnant women get sicker with COVID than other women who are the same age. So COVID is a bigger risk to pregnant women than it is to other women of that age. There's been a ton of study on pregnant women who have gotten the vaccine, and what we found is nothing, right? It's very anticlimactic. It shows that it is just as safe as it is in the general population, and even better than that, that it confers some immunity on the baby to at least the first 6 months of their lives, so it decreases the baby's risk of getting COVID as well. And I know there were concerns about infertility as well, about pregnancy as well. I've had multiple pregnant patients get the vaccine. Nobody's had any issues. I've had multiple pregnant patients get COVID. They weren't happy. And I've had a couple of women who had COVID while they delivered, so I do obstetrics as well. And let me tell you, nothing quite will ruin what is supposed to be one of the most beautiful experiences in your life, like being sick, like having to quarantine at the same time. Any romantic idea of having this beautiful, wonderful birth goes out the door when you get COVID involved.
Well, thank you, Dr. Ripperda, and we'll go ahead and check back with you in just a second here. In the meantime, I want to go ahead and toss it over to my co-anchor, Mark Kiesling.
Thank you, Julie. And we want to take a look at cases in states around our region. In Illinois, health officials report 3,600 new cases of COVID-19 and 17 additional deaths. The summer surge of COVID-19 is causing a spike in deaths in Missouri. Health officials report 124 deaths today and just over 2,000 new cases. And in Kentucky, health officials report 3,200 new cases and 8 additional deaths. The state's 7-day positivity rate remains at 12.47%. Another dose of vaccine now looks very likely. Top health officials are discussing if Americans who received 2 doses of Pfizer or Moderna should get a 3rd COVID shot. But as Camila Bernal explains, there are some, including the World Health Organization, who disagree.
A COVID booster shot after 8 months. That appears to be the plan being developed by top health officials.
The data that the Biden administration is making these recommendations off of is still very preliminary, and these booster shots have not yet received FDA approval for anyone except for the immunosuppressed.
But the 3rd shots for those vaccinated with Pfizer or Moderna could be administered beginning mid to late September, according to sources.
This is proactive, anticipating that more data is in the works, showing that it is both, that the vaccine's effectiveness seems to be waning a little bit over time, and that this Delta variant is worse.
And as vaccines remain in short supply in other parts of the world, others saying not so fast. The World Health Organization says the 2-dose mRNA vaccines provide long-lasting immunity and will not change its recommendation unless the science says otherwise.
All of the world's most vulnerable and those who are most at risk, health workers, need to receive their 1st and 2nd doses before large proportions of the population, or all of the population in some countries, receive that 3rd dose.
Doctors on the front lines say their urgent need is for more people to simply get their 1st shots.
This is so preventable at this point in the epidemic.
I'm Camila Bernal reporting.
President Biden is expected to speak about the vaccine boosters tomorrow at the White House. Julie?
Thank you, Mark. We are back with Dr. Jeff Ripperda with Shawnee Healthcare. Now, Dr. Ripperda, we're talking about possible, booster shots for the COVID vaccine. If that's approved, will you recommend that for your patients?
Yeah, I'll generally follow the recommendations. The hard part about that recommendation, I think, is that we know that the booster shot is going to be safe. It's going to be just as safe as getting the vaccine series is to begin with. Whether it's totally necessary, I think the science is still out there a little bit. We know that a certain percentage of people don't really respond to the vaccine like we'd like them to, and for those people, the booster shot is going to be more important. Elderly people, people who are on medications to suppress their immune system. So, you know, if honestly, if a totally healthy 40-year-old comes to see me and asks me if they need a booster shot, I'm going to recommend it if that's what the recommendation says. But I'd be a little less likely to twist their arm than I will if, say, a 75-year-old with lung problems who's maybe on some medications that turn down their immune system a little bit.
And what would you say tonight to folks who still might be hesitant to get the vaccine because of possible side effects?
Yeah, so I moved to Southern Illinois in 2007 after I had moved away almost 10 years previously as a stupid teenager and swearing to anybody who would listen that I was never coming back. I had to go live somewhere else for a while to decide that, you know what, it's not so bad here. This is my town. When you're a small town doctor, your patients aren't just your patients. You know, they're the parents of the kids my kids play with. They're the people I go to church with. They're the people I see in the grocery store. They're the people who are working at the gas station down the road. It's my community. I know these people, right? I like these people. I don't want these people to get sick. Over that time, so I have a relationship with my patients. I have a relationship with my patients' families. I've lost, depending on exactly how you count, 6 patients just from my own medical practice. I'm not talking about people I know. I'm not talking about, you know, family members, friends. Those are just out of my medical practice. I've had 6 patients die. I've got another couple right now who I suspect may not come home from the hospital. And that's hard to see because there's some people who turned down the vaccine in my office, and that's a really hard thing to look at. And I don't know if they feel regret, but I certainly do that I couldn't get them to take it. And I got several other patients who are permanently disabled, who have suffered major financial hardship because they got COVID and couldn't work. And that's been a fairly common story through the past year. And again, these are not, I'm not talking national numbers. I'm not talking people in New York. I'm talking people in Murfreesboro, Illinois, and Carbondale, Illinois, and Pomona, Illinois. You know, people I know and who I see around town. So again, 6 dead in my practice, several disabled, a couple who are critically ill right now. I have 0 patients who are walking around with a vaccine side effect right now. 0. I bet people have side effects, of course. A lot of people feel super crummy the day after they get the shot. And I've had, you know, one young lady got Bell's palsy, thing that paralyzes the side of your face temporarily. That was probably the worst side effect I've had a patient get from the vaccine. Lasted a week or 2, it went away. So that was I think, the worst that I've seen out of my patients. So do side effects happen? Yes. But again, I've got nobody who's walking around with a long-term side effect, and I've got several patients who are in the cemetery. That's not a hard choice.
I want to thank you for sharing that with us.
Yeah.
And I have another viewer question here. They ask, with the vaccine, does it give you a mild case of COVID-19?
No. So the side effects happen because the immune system gets fired up. So a lot of what we feel when we get sick isn't a direct effect of an infection per se. It's because your immune system is fired up and causes all this inflammation in your body, and that's where you get the effects. So the people who feel super crummy the day after they get the Moderna or the second Pfizer vaccine, or even after the Johnson & Johnson, it's not because they have COVID, it's because they are mounting a massive immune response against COVID, even though they don't have COVID. The vaccine has no part of COVID in it. Let me rephrase that. The Moderna and Pfizer vaccines have no part of COVID in it whatsoever. The Johnson & Johnson vaccine has one protein from COVID in it, but it's not COVID. Saying that the Johnson & Johnson vaccine has COVID in it, it's kind of like the comparison between saying I have a tire versus I have a whole car. The Johnson & Johnson vaccine has the tire. COVID is the whole car. So no, you don't get a mild case of COVID. You get an immune response, which is exactly what we want to happen.
Well, Dr. Ripperda, I want to thank you so much for a very informative interview and for sitting down with us, and all the best to you.
Thanks.